have the pleasure now to welcome, to present two EFA patient experts. One is Susana Balconen, EFA Director, and the other one is Mrs. Elena Boches, current EFA representative as the EMA Patients and Consumer Working Party. And the session is, we called it red tape because we have understood that there are many things that patient representatives need to avoid when becoming experts, giving advice through the European Medicines Agency. So I would like to give the floor now to Susana, who will be presenting us on the main policies to develop the Declaration of Interest at EMA and the electronic curriculum vitae. The floor is yours.
Thank you very much. I will run through the presentation and then I will bring in Erna to bring some reflections and perhaps some corrections as well. Like Isabel said, we call this this part of the meeting the red tape because we as patient experts, we need to fill in many forms and deal with many administrative things. And this is another one. Can I have the next slide, please? Okay, so there are several online resources which were also in the agenda and are in the presentation as well. Next slide. So first of all, since European Medicines Agency is a public agency which is doing the crucial work for evaluating medicines and monitoring their safety, it is absolutely crucial that such a public agency is perceived 100% independent. And in order to do that, it has to be transparent as well. So whether we like it or not, it's very important that we also, as patient expert, we declare any potential conflict of interest that we may have. This is particularly tricky often for patient groups because many of the funding that we are receiving are coming from corporate sources and specifically from pharmaceutical industry. So the latest EMA policy on handling conflict of interest, it was updated in 2020 and it's in force since the beginning of this year. It handles competing interests of scientific committee members and experts who are participating in the medicines related issues at the EMA. And this is important to remember that we are not now talking about patient organizations being involved at the EMA, for example, at the Patient and Consumer Working Party. According to EMA, this policy outlines a balanced approach between evaluating the potential involvement of an expert in the agency's activity due to the interest in the pharmaceutical industry, but also maintaining EMA's ability to access the best available expertise. And best available expertise concerns also patients. So European experts, they are nominated by national competent authorities, which means national medicines agencies, the EMA itself, or the organizations collaborating with the agencies, such as patient groups, and that is European level patient groups. Next slide. So in order to be involved, EMA requires every single expert, whether they are scientific or patient expert, to provide a so-called declaration of interest. And EMA is then screening this declaration of interest And it is divided into 3 different levels of interest: no interest, indirect interest, or direct interest. And this means that if you do not have a direct interest in a pharmaceutical company or indirect interest into a pharmaceutical company, then you have no interest. That is to put it in a bureaucratic way. And EMA uses the information that we as patient experts provide in this declaration of interest to determine if we can be involved in specific EMA activities, such as the evaluation of a particular medicine. EMA bases these decisions on the nature of the interest that we are declaring, the time since the interest occurred, whether it's actually happening now or whether it was already some time ago, and the type of activity that the expert will be undertaking. And that is important when we think about evaluation of medicine or scientific advice on a medicine. Next slide, please. So what is direct interest? Direct interest in a pharmaceutical industry is, of course, if you are employed with in a company, but also whether you provide any kind of consultancy to a company, or if you have a strategic advisory role for a company, or if you have a financial interest in a pharmaceutical company, or if you are involved in repurposing of a medicinal product. But the last one, it only really concerns usually healthcare professionals. Repurposing means being involved somehow in research or anything so that a medicine would be used in a different way that it has been approved to. So consultancy and strategic advisory role, these are actually very common for us who are either employed or volunteers or volunteer board members having a specific role in the organization. We often participate in different kind of whether it's a steering committee or advisory committee, advisory group, or anything similar to a specific company. So that provides a direct interest when we think about being involved at the EMA in anything that is concerning medicine. So that makes our life not so easy, and that is why Maria also said in the previous session that it's good and very important to think about in our organizations which patients and patient advocates from us are involved in which activities of our organizations. I personally call it keeping clean and dirty patients. Of course, we are not dirty, but we are very proud of what we are doing. And Maria also said that it's very important that patients give advice to companies as well. But in fact, involvement of an expert in a research work for a pharmaceutical company, which is more and more happening now. Patients are also part of research work, sometimes advising companies. That is not a direct interest. It's an indirect interest that we come into the in the next slide. Don't go yet to the next slide, please. can we go back to the slide of direct interest? So now in this, you might think that if you are just a volunteer in an organization, do you have to declare everything that is that organization that you are working with is involved with? You do not have to, in the sense that if another person from that organization is doing consultancy or strategic advice to a company, you don't have to declare that. But we will come back to this point in the indirect interest. Now, what is new in this declaration of interest policy is that technology sector and medical device sector are also there, not only pharmaceutical industry. So the direct interest towards them is pretty much the same than for the pharmaceutical companies as well. Can we go to the next slide? Then indirect interest in a pharmaceutical industry means that you can be a principal investigator. We know what this means, investigating a product of that company. Or what was mentioned already in the direct interest, involvement in the repurposing of a medicinal product, or also linked to the research activities investigator for a pharmaceutical company. And I already mentioned that involvement of an expert in research work on a consultancy basis. That is also indirect interest. Then we have it emphasized here because grant or other funding from a pharmaceutical company to the experts organization and institution, that constitutes an indirect interest. Or that a close family member has direct interest in a pharmaceutical company, meaning being employed, for example, by a company, your spouse. So that is an indirect interest. And again, when it concerns the biotechnology sector or medical device sector, is the same. Next slide, please. Okay, before I go into that, I would like to talk a little bit about the interests. So the approach for declaring an interest should be, I want to declare every single interest that I can possibly imagine in how I am involved in different organizations and how they, for example, receive funding, or any kind of participation in a steering committee or whatever for a company. So I would advise everybody to have that approach to the declaration of interest. Maria also mentioned that there is this breach of trust procedure that the agency has. But we don't want to get into that, and we will not if we follow all the advice, and the EMA is always there to support, to fill in the declaration of interest. Now, the declaration of interest is combined with an electronic curriculum vitae that you also have to either, I think you can upload if it's in certain format already, you have a CV in certain format, or you need to fill it in. When EMA is evaluating the level of interest that you have, they are also looking at this CV and looking whether the declaration of interest matches with the CV. But don't worry, it doesn't mean that you have to list every single, I don't know, steering committee participation or whatever that you had or had in a certain time frame or are engaged with into your CV. because that is not necessarily the kind of information that you always want to have in your CV. But we take it vice versa, that there is something in your CV that you are not then declaring in the declaration of interest. That is a problem. The breach of trust procedure, I have no experience in that, but for example, at EFA, we have had cases where we asked our members who would be willing to be involved in a specific scientific group, ad hoc scientific group happening at the EMA, or in a scientific advice procedure. And then there were some volunteers. But in one case, then when EMA was evaluating the declaration of interest, it came out that this person who was volunteering in a small patient group, they actually worked for a pharmaceutical industry from a completely different field, but still. And then this person couldn't be involved. So there was no breach of trust procedure there. But it was because of also our ignorance as EFA that we were not looking at that. There was another case also, because sometimes, for example, doctors, they can be patients as well and very active in a patient organization. So in one case, we nominated somebody who is a patient, but also a doctor. And then it came out, and EMA found this out, that they had in their role and wearing the hat of a doctor, they had been talking with this company whose product was under evaluation. And it was our naivety and non-thoroughness that we didn't understand all of these issues. But then also there was no breach of trust procedure, because in fact this patient expert then was not involved. Are there more slides, or can I very briefly show an old declaration of interest of mine?
You can go ahead with that old declaration. Well, there is a
okay. So preparing your declaration of interest, there is, like Maria said, you can always contact the EMA that you would be interested in being involved. The declaration of interest is also on the website, the template for the electronic curriculum vitae, and an expert nomination form, where there is nowadays also this opportunity that you can tick, I'm a patient or consumer expert, and this is my area of expertise. And that nomination form, it will actually help EMA then to come to you for a specific issue. Now, this declaration of interest needs to be updated once a year, but you don't have to worry about it in a sense that EMA is alerting about that. You will receive an alert and a sufficient time to update it so that it's up to date with the newest information. There is a lot of guidance for this, and if it's an organization, for example, like EFA, who is nominating you, we help with dealing with this red tape. And don't let the red tape prevent you from signing up to work with the EMA, and don't worry about your conflict of interest level, because there are always nuances, and EMA is in any case trying to always look the best experts, and sometimes it will be at the discretion of the activity and the chairs of the committee involving patients, how they might also involve somebody who has a higher level of conflict of interest. If I briefly show an old form of mine, it is probably not the same. Do you have it, Isabel and Jeff? Yes. So I have the direct interest. If you go up, I have direct interest in pharmaceutical. Can you go up to the form? Yes. So I am employed by EFA. Can you go up a little bit? Thank you. Yeah, so I am employed by EFA, and of course, as such, I have responsibilities and actually the privilege of take care of also the funding of the organization. So I'm also involved with the companies that are supporting us. If you go down a little bit. So in the first, so here are some of the categories that we talked about already. Employment, no, I'm not employed. Consultancy, no, because at that time consultancy meant a little bit different things than now. But strategic advisory role, yes. So first, I am involved in certain advisory committees, and this involvement, I don't receive direct honorarium on any of these. It is EFA who receives, but this is not, it doesn't change the level of interest. The interest is direct in any case. If I would be receiving honorarium, then there are other things that are linked to. So that's another category. Okay, so can you move a little bit? Yes. So I have no direct financial interest, meaning I have not received a honorarium myself, and I do not have any stocks of a company. And this knowing about the stocks is something. So if it concerns, for example, an investment fund where the funds are diversified, so you are not expected to know which funds and which companies are in there. So that is not a direct financial interest. I am not investigator, of course, because I'm not a researcher. Then grant, funding to organization, institution. So now I will leave it to Maria and Erna comment later on whether how far you need to go if you are a random volunteer in an organization in declaring all of these. So we have chosen to give all the details, also the amounts of sums, whether we are receiving core funding or project funding. So we are putting everything here, just with the approach to declare as much as possible. If you go down to the form, there is this space, any other interest or facts. So here I try to explain how the funding works at EFA, and I also list some of the other groups like think tank of the European Federation of Pharmaceutical Industries and Associations, and any other involvement that I consider important. And here you can also say if you are a volunteer or if you're employed or whatever. And you can even say that I have no direct contacts with the companies that the organization is funded by. This is the end of my presentation. I hope it's not too intimidating for the conflict of interest, but it is the necessary evil so that we can have the public trust at any times for our beloved EMA, important agency. I would like to hand over to Erna for any reflections.
Thank you very much, Susanna. It's quite impressive. But I can tell you good news. When you are a very clean person and you have no interest, it's only, in fact, ticking the box, thinking perhaps I have some stocks, but it's not a direct problem. But the form is still the same. Best advice is use a computer laptop with Microsoft Office, because otherwise it won't work. And that's how do you know, confusing, because you fill in the whole form and then take send and nothing happens. Also the date of sending will be automatically, it's only working on Microsoft. Also sending another form, I do have a Gmail account, it's not accepted, so I use from my home friend his Outlook account, and then it's also working. But the best news is, when you struggle in the form, you will meet such a nice people, because that's my feeling with EMA. When you like to talk with warm people, and will respect your problems, and we will help you, it's EMA. And so during the last period, I was involved in many labels. I was also involved in pre-stage of a new immunotherapy, and also immunotherapy. It's now on the market, and it can be confusing also then, because you have to use the EMA system. But my good advice is write directly, because you get an answer in an hour, and they will help, or they will call you. And the declaration of interest of EFA is not my interest, of my declaration of interest, of your interest. Fill in and you will see it's quite simple. And be honest, and EMA is always honest to help you. That's it.
Thank you very much to both of you, Susanna and Erna, for sharing your experience being a patient representative to EMA. I would like to ask briefly if there is any question immediately arising from our participants. I haven't seen anything coming, but I just want to double check.
Or if Maria wants to correct something or give some additional remarks.
Just very quickly in one word, what I would just like to say is, if someone is a volunteer for an organization, they do not need to declare the funding to that organization. It's only if you're employed. So that's an important distinction that we make. If you're a volunteer, you don't need to declare the funding. But as Erna and Susanna said, we are here for any questions. Maybe even before you start completing your declaration of interest, it might be worth just talking with us. And thanks to EFA for giving such support to patients updating their declaration of interest. Great to see. Thank you.